Hi everyone, welcome to this Tiny Tickers webinar. I'm sorry we're a couple of minutes late starting. We were just having some technical issues with some of the slides we're going to show, so you might have to bear with us a little bit, but we'll do our best to make it all move seamlessly along as we go. But you're very welcome to this webinar. It's the latest in our series of family support webinars. I'm delighted that you've been able to join us today. The topic we're looking at today is having another baby once you've already had a baby with CHD, or a pregnancy where the baby had CHD. And obviously there's all sorts of issues to consider there. When we sat down and started talking about this topic, we realized just what a big topic it is. So we've got a couple of different perspectives today, which we're joined by Gill and Rachel, I'll introduce shortly, but we're going to cover a clinical perspective, looking at screening process when you go back and have another baby, looking at once the baby's born, some things to consider. But then also look at the psychological perspective, because obviously it's quite a burden on families to go through another pregnancy once you've already had a difficult time with the first one. So we're going to try to come at it from various different perspectives, and hopefully you'll go away with lots of tips and bits of information to help you on your journey. The chat should be open, so you can jump into the chat if you want to, no pressure, but if you want to jump in and say hello, introduce yourself, tell us where you're from, tell us a little bit about yourselves, and that would be amazing. Vicky from the Tiny Tickers team is in the chat. And we'll be looking out for any comments. It's worth keeping an eye on the chat as well, because Vicky's going to put some signposting, some links, some bits of information in there as well. So do keep an eye on there. As we go, if you've got any questions, we're going to do a Q&A at the end. So there is a Q&A box within Zoom, which you should be able to see on your Zoom menu. And if you get any questions as you go, feel free to type them in there, and we'll try to answer as many as possible at the end. Assuming we can make the presentation work, we've got about a 20-minute presentation for you from Gill, and then we're going to hand over to Rachel, who's going to talk about the psychological side, and then we should have plenty of time, 10-15 minutes at the end for any questions as well. So this is the latest in our series of webinars, as we mentioned. So you might have seen on our website, we've got various different family support webinar topics, from starting school and nursery with your little one that's got CHD, through to how you treat siblings, taking a little one on holiday, parental health and well-being, all sorts of different topics of the webinars as well. So if this is your first one, then do feel free to go on the website and work your way through and just watch anything that's relevant to you. And it's part of our overall support offering of support for families, babies with CHD. So you might have seen on our website, there's loads of family stories, lots of information there. You may have joined our Facebook group. If you haven't, I would thoroughly recommend that you do so, where you can get loads of peer support. You may have come along to one of our support groups. So whichever way you access support from Tiny Tickers, there's loads of options for you there. So if you haven't explored them all, please do so after the session. So I was going to say right at the start that we're not IT experts, and sometimes things do go wrong, and I've been proven right already. So we're going to try to get this presentation going in a minute, but please do bear with us. If you drop off the call yourself because of a web issue at your end, you should just be able to jump back in using exactly the same link as you used to sign up in the first place and to get here in the first place. Okay, I shall introduce our two speakers now. Gill McBurney is a cardiac nurse specialist who's got a lot of years of experience working with babies and children with CHD at Alderhay Children's Hospital in Liverpool. So thank you very much for joining us, Gill. Gill and our Head of Health Professional Training and Deputy CEO, Anne, we're going to do this as a joint presentation. But Anne can't be with us, unfortunately, because she's now in clinic doing some scanning. So Gill's going to cover off both aspects as best you can, aren't you, Gill? And then we've also got Dr. Rachel Avison, who's a clinical psychologist working at one of the regional cardiac centres. And some of you may know from our support groups, because Rachel's been one of our facilitators of our family support groups for a number of years now as well. So thank you both very much for joining. I didn't really properly introduce myself. So I'm John, I'm the CEO of Tiny Tickers. And I guess I've got a little bit of background in this as well, because I've got a now 19-year-old daughter who was born with CHD. And we subsequently went on to have two further now strapping young sons. So I've been through some of the same considerations that you as parents might be thinking about or going through yourselves at the moment as well. So hopefully between us, we can give you some really good information today. Everything is being recorded, so we will be able to send out a link to this, so don't feel as though you have to make notes or whatever. You can come back and you can watch various bits of it again. in your own time. We should be able to get that recording up in the next few days, and we'll email out the recording, lots of handouts, lots of information as well in due course. Right, so I'm going to hand over to Gill. In the meantime, I'm also going to try to share Gill's presentation. We're going to have to do the old COVID next slide please thing and see whether that works. But if you just bear with me now, I should be able to share the presentation, Gill. Okay, so hopefully everyone can see the presentation. If you can't see what I'm looking at now, please do say so in the chat, but hopefully you should be able to see a presentation screen that says having another baby and introduces Anne and, of course, now Gill. So Gill, over to you.
Okay, thanks, John. So hello, everybody. Yeah, so I'm Gill McBurney. I'm one of the fetal cardiac nurse specialists. I work in Liverpool. So I work primarily between Alder Hey Children's Hospital and the Liverpool Women's. So what we're going to talk about today is having another baby, thinking about having another baby, and try not to lose sight of how exciting and lovely and wonderful that actually is. But we do also appreciate actually it can be quite a daunting thing to think about, especially if you've had a particularly difficult experience with your child who has got congenital heart disease. So when we first start talking to families about doing this, John, if you could go on to the next slide, please. Some of the words that they come back to us with are this kind of feeling worried, stress, another pregnancy, feeling another pregnancy is going to be a difficult pregnancy, a sad pregnancy, a worrying time for everybody, panic. Some people say they're quite traumatized by the thought that maybe they have to go back through the same type of centre, the same procedures, seeing the same people, and albeit that we would hope that we give you really good news having another baby with having another baby, there's obviously always that worry there that that might not actually be the case. So next slide, John, please. So we'd say about preparing for another pregnancy is you follow all the national guidelines that we have in the UK about women who want to be mums, and you do all of the things that you're supposed to do doing that. But also the added things that if you want to talk to somebody before you even get pregnant, is to think about talking to your GP, your health visitor. Mainly you probably will be speaking to your cardiac nurse specialist. I think if you've got a child who's got a chromosome condition as well as a heart condition, you might want to take some advice from a genetics team before you consider getting pregnant again. But also that if you're in clinic with your child who's got CHD, it's worth just asking the cardiologist about what do they think, and you'd be thinking about having another baby. What's the guidance? Where do you go? What do you actually do? And then we know that a lot of our families, because the CHD family community, if you like, in the UK is vast and everybody is very, very helpful, is you might know other families. You might have met other families through your child. You might meet other families through organisations like Tiny Tickers or Little Hearts Matter, or coming to the hospital to say, we'd like to speak to another family. Could you put us in touch with somebody? Okay, next slide, John. So the aims in the UK of the fetal screening echo service, and it's a little bit different kind of depending upon where you are, what condition your child has, and I'll talk a little bit about that in a minute. But the aims of the fetal screening echo service is to detect any congenital heart disease, but also to try and offer some reassurance to our current population. So our families that have already had one child, maybe two children with congenital heart disease. So that is the whole aim and the umbrella of having a service that you can have a fetal echo. So next slide.
How the fetal heart develops. Hearing or seeing a baby's heart beat for the first time is a very special experience. Here at Tiny Tickers, we want to share with you the amazing story of the development of the heart throughout each stage from conception to birth. Here is the embryo, around 18 days after conception. It is about the size of a raisin. We can see the head region and 2 tubes are visible that will form the embryo's heart. Around 3 days later, at around day 21, These primitive heart tubes have moved below the developing head region. By the next day, the tubes have fused together and moved to the area that will eventually be the chest cavity. It is also around this time that the heart begins to beat for the first time and can be seen on ultrasound as a little flicker. Over the next 8 days, the tube starts bending into an S shape and to the right into a simple version of the heart with distinct chambers. By the time the embryo becomes a fetus at 2 months, the heart is fully formed. It bears a close resemblance to what it will look like after the baby is born, but there are differences between how the fetal heart works and how the heart will work after birth. This is how the heart works in a newborn baby and throughout their life. Here is the right atrium, right ventricle, left atrium, and left ventricle. The 2 major blood vessels are the aorta and the pulmonary artery. Blood from the body enters the right atrium, then goes to the right ventricle. From the right ventricle, the blood is sent to the lungs, where it becomes oxygen-rich. Then the blood flows back to the heart, filling the left atrium, and from there into the left ventricle. The left ventricle pumps the oxygen-rich blood through the aorta, which carries it to the rest of the newborn's body. Now, let's look at the process in the fetal heart. You can see it has the same basic components as the newborn's heart, but there are a couple of important differences. All of the oxygen the fetus requires is being provided by the placenta, as babies in the womb do not use their lungs to breathe in air. Because of this, much of the fetus's blood is diverted away from the lungs through 2 openings or connections. These are called the foramen ovale, which connects the right and left atria, and the ductus arteriosus, which connects the aorta and the pulmonary artery. As blood enters the heart into the right atrium, some of the blood flows into the right ventricle, in the same way as it will when the baby is born, but some blood also flows directly into the left atrium through the foramen ovale. This blood will pass directly into the left ventricle and be pumped out to the body without ever going to the lungs. In addition, some of the blood that entered the right ventricle and would in the newborn go to the lungs does not do so. As blood is being pumped out to the right ventricle towards the lungs through the pulmonary artery, some of that blood escapes into the aorta through the ductus arteriosus, bypassing the lungs as it does. These 2 important connections will remain open until the time of birth. Within 30 minutes after the baby takes its first breath, the majority of ductus arteriosus will completely close and the flap of the foramen ovale will shut off like a valve. This happens because of an increase in pressure on the left side of the heart and a decrease on the right side. These changes in the heart anatomy cause blood to flow to the lungs, which will then take over their job of supplying oxygen to the body throughout the person's life. We hope you have found this video informative. For more information about babies' hearts and our work helping babies with heart defects, please visit tinytickers.org.
So what that video showed, I mean, Joe, you'll be able to talk it through a little bit better than I can, but basically that just shows the basics of how the heart develops, doesn't it?
Yeah, it does. It talks about from very early on in fetal life and going through the whole thing, the baby being born, and what we always say we're quite amazed that the heart is such a complicated, intricate organ of the body, that it's amazing really that it's all put together properly over 99% of the time. And so it's quite an extraordinary organ to grow really in the middle of growing a little baby as well. So yeah, so it just shows how complicated it is, but it is well worth the watch. And I mean, we show that clip too when we do training with junior doctors and even registrars, because it's very simple and easy to understand actually how the heart develops, because embryology is very, very complicated and very high level things, but this is a really straightforward clip to watch, so it is worth watching.
Exactly as you say, Jill. Whenever I watch that, the reason we did it is to just sort of explain how complicated the process is and how early during pregnancy the heart's formed. It always strikes me as a phenomenal thing. So we'll send that out, but in the meantime I think hopefully everyone can see the next slide, which is around antenatal care. So if you want to move on to that one, Jill, I'll turn the video.
So we think about who should be referred for a fetal echo, and there is national guidance about this. So, and what we think about is if you've had one child with a heart condition, the chance of it happening is slightly higher than your general population risk. So it's around about 2 to 3%. If you've had 2 children affected with congenital heart disease, that chance increases to about 10%. And if you're in a position where you've actually had a number of children in a family, around 3 children affected by congenital heart disease, which I must say is quite unusual. You know, it's a very unusual situation, that is that your risk is actually up to about 50%. The other people that we would see antenatally are families where there's a family history of cardiomyopathy, but it would be cardiomyopathy that is developed early on in life rather than adults who have got a cardiomyopathy diagnosis. And also that if you are a woman that's affected by having a positive antibody screen, then there's a small chance that baby could have a problem with their heart rhythm or the rate of their heart rather than their rhythm, and you would be referred for a fetal echo as well. So the next slide. So when should the fetal echo take place? Now, we know that this is a little bit different around the country. We know that certain areas of the country do fetal echo much earlier than others. So it's that's why we always recommend that you speak to your local team about what is on offer, or how does the service run, at what point could you be seen. And some of this is postcode, some of it is, we know, centre related, some of it is condition related as well. So it's very important that you have that conversation. So sometimes you'll be offered first trimester screening depending upon your family history, usually around 15 to 16 weeks, providing baby is in a good position and the maternal BMI is average or low. 18 to 23, I'll start that again. 18 to 23 weeks is the most common time, and often they'll try and do it alongside or a similar time at doing the anomaly scan at around about 20 weeks. And there could be some third trimester screening done as well. So some patients will require another echo because we know that things could change. And again, this is condition specific in your previous child, or it's something that the first person that has a look thinks, oh, it doesn't look quite okay. I'm not absolutely convinced it's okay, but I'm not absolutely convinced it's not okay. So they might ask for a repeat fetal echo. There are some limits to looking at the heart later in pregnancy. Often people think that it would be easier to look at a fetal heart at 35 weeks because everything's bigger, the baby's almost ready to come out. But in fact, it's harder to scan, or it's harder to see. It's not harder to scan, but it's actually harder to see details in a pregnancy where the gestation is a bit later. So next slide, John. So there are some conditions where it's not, you wouldn't be referred for a fetal echo, or it's not required to have a fetal echo, and that's to do with how the fetal circulation is, which you'll be able to see on that clip. So PFOs, which are little tiny holes in the top 2 chambers of the heart, and a PDA, those are always present in every fetus because it's required for fetal circulation in order for baby to get blood going around their body, because the blood doesn't go to the lungs antenatally. So these are 2 little parts of fetal life that if you have that as your diagnosis after a baby is born, then you might need a procedure to intervene with that. And it doesn't necessarily then require for you to have a fetal echo in a subsequent pregnancy, because your risk actually would be the general population risk. The other thing that's quite difficult to see, so when people have a bicuspid aortic valve, you wouldn't be referred for a fetal echo at that point as well. Sorry, John, I lost my train of thought there. So next slide then. So what's beyond the scope of an antenatal scan? So at 16 weeks, the fetal heart is around 0.5 centimetre in size. Around about 20 weeks, it's about the size of an acorn. So it's still very, very small. It's beating very, very fast. And it's inside a fetus that's doing this, going round and round. So it's actually quite a skilled thing to do, to look at fetal hearts. And what we're looking at when we do the fetal echo is we're looking at the heart chambers, we're looking at their size and how they're working, we're looking at valves, we're looking at the position of vessels, we're making sure that everything is as it should be, and that the vessels are all in the right place, so they're coming from the right place and they're going to the right place. What we're not able to exclude, some of you might already have been told this if you had an antenatal diagnosis with your congenital heart child, is that we can't exclude small holes, minor vessel narrowings, minor valve abnormalities, because they're so tiny it's not possible to see them in a lot of detail, and some conditions that we know that can evolve over time, which is why you might be offered a scan later on in pregnancy as well. Now, some of those conditions, or some of those things that we can't exclude, could still require an intervention sometimes during infancy, but more likely to be a little bit later on. Next slide, John. So thinking about when baby's here, so you've had your fetal echo, you've been told everything looks okay, the heart structures are normal, everybody's happy with how baby's growing, everything's okay, and then luckily and nicely and very, very exciting is that baby is born. So when babies are born in the UK, they all undergo what's called an IP, which is a newborn and infant physical examination. What people will talk about being just a newborn exam. It's a top to toe examination. And I've put the link at the bottom of this slide for the national guidelines to explain what they are and what they do. But the programme is designed to identify and have children referred who are born with congenital abnormalities, looking at the heart, the eyes, in little boys looking at testicles and making sure that baby's hips are okay. And if there was anything that was concerning or raised a flag or somebody thought it wasn't quite okay, the person that's doing that exam would be seeking some further advice for you. The guidelines say that it should be done by 72 hours or at 72 hours. So it's obviously usually done before you take baby home. It's to further identify abnormalities a little bit later on in infancy. So you probably understand that babies have a newborn exam and then they go home, and then around about 6-8 weeks they have a second exam, and that exam is normally done by a GP or a nurse practitioner in a GP practice, and that again, that's to try and rule out anything that maybe just wasn't picked up when baby was first born. And the overall idea behind this examination is to reduce mortality and morbidity in infants in the UK. Now, one of the other things that some hospitals will do, and it's estimated it's around about 85% of hospitals or maternity units would do a pulse saturation check, an oxygen saturation check before a baby is discharged from a hospital. So that's almost the whole country, but not quite. So next slide. So some centres, and again, I can't reiterate this enough, is that not all centres will do this. So if you have a normal fetal echo and you have a normal newborn exam, the chances of baby having a heart problem are obviously very, very small. But for some of our families where you've had maybe a very, very difficult time, maybe you've had a baby or a young child that's passed away, you've had a really, really big condition, like something like a hyperplastic left heart syndrome, some centres would offer a reassurance scan. So again, this is really why you need to speak to your local team, or the team that will be doing your fetal echo, or the team that is your local cardiac unit, to see what is actually on offer. So it is specific to each centre. When you attend for your fetal echo, they should tell you whether you could have a reassurance echo or not. And we would say, if they've told you that you can have a reassurance echo at your local cardiac centre, ask them if they could put that in the fetal report, because that would help later on when baby arrives. It can require a GP referral despite all of that. Sometimes it just requires a call into the cardiac nurse specialist and a conversation to say, oh, baby's been born now. I was told I could have a reassurance echo. What do I need to do next? It's extremely unlikely it would be done before you would be able to take baby home. And again, not all centres would offer a reassurance scan, but if it has been discussed, please just make sure you get that in writing. But just be reassured that even though we talk about a reassurance scan, that fetal echo screening program while you're pregnant and the newborn infant exam is designed to try and stop babies going home who actually have a diagnosis. So despite saying all of that, we know that oftentimes until you've got baby in your arms and baby's at home and doing very well, and you've had your reassurance scan from a cardiologist that you might already know, we know that oftentimes that's when you do relax. But the whole process is designed to try and keep you reassured at every step of the way that this subsequent baby hasn't got a heart condition. Thank you. So, oh, sorry, I forgot about our summary slide. So in our summary slide, we would say we know that it's very mixed emotions. We know that having another baby can fill you with dread. It could be, as I said, I know, and I've looked after families where it's actually quite traumatizing thinking about going through this process again. Said that not everybody will need a fetal echo, that you might attend at different times during your pregnancy, depending what your centre will be able to provide for you, and that be reassured that all babies get a newborn exam anyway. And if you have any worries, I always say speak to your nurse specialist, because we're the people that you'll call for 18 years to help you with any queries that you have along the way.
Brilliant. Thank you, Jill. Well, we're 19 years in with my daughter and we're still this is every so often. So yeah, absolutely. I think that was one of the things that really came across in that talk, that presentation. There's a lot of information in there. So thank you for that. But there are differences, obviously, based on what condition your previous baby with CHD has had, but also then there are regional differences.
Yes, definitely.
Everyone does this slightly differently. So I guess the message is to ask if you're not sure, to contact your local team, your cardiac nursing team or whoever it may be, and just ask what the process is. And don't be afraid of asking questions, because
that's right.
Sometimes we don't like to bother people, do we? But it's really important, and having clarity and knowing what you're going to be able to access is really important.
Yeah.
Brilliant. Thank you so much, Jill. Thank you for bearing with us during those technical issues as well, everyone. I'm now going to hand over to Rachel, who's going to talk a little bit about the psychological side of then subsequently having another pregnancy or another baby.
Thanks, John, and thanks, Jill, as well. There was so much really valuable information, and you're right, you're a real source of support in your clinical nurse specialist role. So yeah, absolutely give the team a call about anything you're concerned about. So I'm Rachel. I work as a clinical psychologist in the congenital cardiology unit in West Yorkshire. And thank you, John, for inviting me to talk today about supporting you in having another baby or considering having another baby. I was putting some notes together, thinking about families I work with in the hospital, conversations we've had through therapeutic sessions, and trying to kind of pick out the key themes, because there are some threads that run throughout a lot of families' discussions with us in the counselling and psychology service. So what I'm going to do is break down those themes and talk about them one by one. I think the first thing to say is, when thinking about having a baby, this goes back a long, long time. So it's not something that people think quickly or rapidly about. Usually for many, expectations about becoming parents start very early. And we know from research that this can start in childhood. So from being a young child and being parented to becoming an adult and considering parenthood, we start to imagine what we'll be like as parents. So what will we do with our children? What will I be like? What sort of mum will I be like, or dad will I be like? And what will their personality be? These ideas form very, very early. So when things don't go as we'd planned or envisaged, with the pregnancy, the birth, or beyond, it's really, really understandable and normal for our hopes and dreams and plans to feel different, look different, and the expectations of parenthood can be completely shattered. So I think it's really, really difficult when you've had a tough experience, because the expectations of what life might be like can be really interrupted and change vastly. So hold on to that. The reason all of this decision making is so difficult is because it is difficult. You've been thinking about being a parent from being a child or a teen or a young adult yourselves, these decisions take a lot of consideration and are a long time in the making. when thinking about having another baby, hold on to that experiencing an antenatal diagnosis or a postnatal diagnosis or even a baby loss is a really, really complex process. So it's complex physically, particularly for the woman. Also for partners, we know the stress that they endure kind of impact them physically, but it's also very highly complex emotionally as well. It's highly personal and highly unique to each individual. And we know that from when we offer peer support groups, everybody sometimes has a different stance or an outlook, and that's okay. It's holding on to this is entirely unique to you, a unique experience for you and unique to you. And what we also must remember is that our ability to make decisions or our avoidance of making decisions is deeply rooted in past emotional experiences, which I'm going to refer to as trauma. We don't use that word lightly, but we know that going through fetal diagnosis, antenatal diagnosis, postnatal diagnosis, or baby loss, and experiencing the devastation of hearing that your baby has a congenital heart defect is devastating, but it is also traumatic. And I think Gill mentioned that in her presentation as well. So hold on to the impact of the trauma on decision making and it being so hard to do. So I'm going to break this little presentation down into the three sections. So firstly, thinking about previous antenatal or fetal diagnosis. So if you've been through a previous pregnancy and your baby's received a cardiac diagnosis at the 20-week scan, you will still remember, I mean, this could have even been years ago, but you will still remember the feelings of shock on hearing the difficult news. Perhaps you remember not quite believing the information you were told. It's really understandable to not be able to wrap your head around the information you're given. Perhaps you might remember feeling bewildered, difficulty making sense of complex medical information with medical terminology, surgical terminology, care planning, decision making about your baby, their health, their future, and also with limited time to make decisions and choices. Obviously, from 20 weeks to the point of birth, there isn't much time to make decisions, think about things, and talk about things at length. So you might have really, really vivid and clear memories of that time. We sometimes call this a flashback, where you can picture yourself being with a sonographer or being called into a side room. But those images in your brain are very, very quickly and easily brought to mind and can be really vivid and clear. Sometimes we experience reliving those memories, what the doctor said to us, what the sonographers said to us. But it's that experience that makes all of this so hard and so complicated to think about having another baby. For some, they remember the real juxtaposition through going through 20 weeks of a joyous time or an exciting time, or feeling the anticipation of having a baby and becoming a parent, and then that juxtaposition of the sadness, the worry, the disbelief at a cardiac diagnosis through the scan process. So this is a really isolating time for couples. Through counselling and psychological support that we offer in the hospital, we see this time and time again. People sometimes feel like they can't talk about it because it's been really, really intense for them. They sometimes think people just won't understand. Sometimes people go, "You'll be fine," and they're very hopeful, but it's the reassurance doesn't land with couples when they're feeling really frightened, understandably. But yeah, hold on to memories of antenatal diagnosis can be trauma memories, and that's why it's so hard to think about putting yourself through that again. And as Gill was saying, there's lots of reassuring information out there. You are closely monitored. There are national guidelines to follow and to keep you and your baby safe. But equally, you hold on to those memories in your brain, those images in your mind, and that's what can contribute to that feeling of avoidance in terms of decision making and taking the next step to have another baby. This pattern is very similar when we think about a previous postnatal diagnosis. So for many heart parents, their pregnancy might have been really uneventful and a time of kind of feeling excited and hopeful. And then, all of a sudden it can be incredibly hard to learn that soon after your baby's birth, or in the weeks and months after your baby's birth, that they have a heart condition and will require treatment and care, sometimes surgery. As described above, it's normal and natural to feel shock, fear, overwhelm. Sometimes people feel guilt. Did I do something wrong? And we in our sessions we talk to particularly women who sort of soul search. Did I do something? Was it this? Was it that? To really rack themselves with guilt and a feeling of did I do something? But there's such a mixed bag of feelings when you go through that sudden shock of diagnosis. And particularly when you are diagnosed postnatally, things happen in a very, very almost uncontrolled way sometimes. You don't get a choice always about when you're coming in for surgery. Things happen quite quickly. You might have had a long time of feeling very worried about your baby, so you've held on to that. So sometimes it does bring about a relief when a medic will say, yeah, we're going to offer some treatment. But usually the prevailing feelings for families are being bewildered, disbelieving the information they're told, and then almost being catapulted into this medical world that they had no control or experience or preparation for. When we think about bringing babies into hospital, we might think about them having neonatal care, intensive care, or high dependency. So sometimes families find it really difficult when they didn't know they were going to need hospital care and treatment to arrive at these wards. Sometimes we can experience something called vicarious trauma, where you absorb the traumas and distress of other people around you, and see them having very difficult experiences as well. You can sometimes absorb that. Sometimes it's the shock at seeing your baby poorly, having breathing tubes, nasogastric tubes, having to be in a hospital cot or a hospital bed. All these images and memories are really, really distressing. And again, just as I outlined above, it's that becomes a trauma memory, and it's that trauma memory that makes us really, really avoidant of ever having to kind of consider going through that process again. And it's a real barrier to us, having or going for what we want in life. And I think also to add to that, we be remiss of us not to consider families who have lost a baby due to cardiac diagnosis. And for some families, their parenthood journey comes to a tragic end really early on. And this can be during pregnancy or after the birth. But what we know is it can take an extremely long time to ever feel almost ready to consider parenthood and starting that parenthood journey again. We know that everybody's unique. Everybody is unique in their grief and their feeling of loss and experience of loss. And for some families, they might take years and years to really fully feel ready to take that next step and try for another baby. And I guess what another theme from counselling psychological sessions in the hospital that we see is that sometimes families aren't always aligned. And this can make it really, really difficult in terms of your relationship if one person's really keen to have another baby and another member of that couple just isn't quite ready. And what we would always advise is just keep talking and being honest about how you're feeling, and hold on to that your grief is entirely unique and personal to you, and there is no timeline that you can put on that. It comes in waves, and sometimes those waves feel stronger and more kind of debilitating than others. But yeah, there's certainly an emotional heaviness that comes with going through fetal scans, postnatal scans, and baby loss. And it's these really, really strong feelings that create sometimes a really strong sense of avoidance. When we go through a trauma, we know that our body goes through lots and lots of different physical feelings. And I'm not really talking about the pregnancy, I'm talking about the stress. So physiologically, we can still experience tightness in our body. You might notice tension in your shoulders or your jaw, or physiologically, your heart might be racing, or you feel that tightness in your chest. And that's when you're just from those memories, reliving it in your mind and thinking about those memories of your baby or your pregnancy can bring about those physiological feelings. And what message that communicates to our brain is that there's a threat, something's threatening, something's scary. And even though we know there's no immediate threat, we're not in immediate danger, there's no immediate harm, the stress that we're feeling in our body and the sort of disruption of our nervous system communicates a signal to our brain and goes sort of danger. And it's a very primitive part of our brain that we've evolved with over thousands and thousands of years, but it feels horrible to experience that. And what the experience is, it's a release of adrenaline in your system because your body's saying, I'm stressed, we're in threat, we're in danger, and you go into fight and flight responses. So you might notice that you feel physically really, really abhorrent and you just want to escape that feeling. But we know it's those thoughts and those memories that are keeping this almost like a loop going. So difficult thoughts and feelings and memories brings about these physiological feelings, and they can go in this loop. And sometimes that subsides over time, but sometimes it doesn't. And when we know you have that physical feeling and your brain is signaling something's dangerous or something's threatening, we avoid and we step further and further and further back from the contemplation of wanting to go into parenthood again. So hold that in mind, that your brain remembers your experience of your pregnancy and birth and beyond. And yeah, it's stored almost like as a trauma memory, and that's what's triggering our bodies to feel all those unsettled feelings. And yeah, so we always want to try and escape those feelings of adrenaline, and it doesn't feel very nice. But actually, it's knowing you're safe in the moment. You're safe, and to ground yourself into the here and now, and try and bring your thinking back to here and now. It sounds complicated, but at the end, I'll talk about who you can talk to if you want some further guidance or support psychologically. Okay, let's just whiz on a little bit. Thinking about change then. So change is thinking about having another baby, and thinking about putting yourself out there is really, really difficult because of everything I've described above, those trauma memories, those physiological feelings in the body, and those memories that are stored in the brain. But what I will say is that by being here today and watching the webinar, or watching the webinar on YouTube after the event, is a really, really positive step. When we think about change psychologically, there are certain stages and steps. And I think for everybody on this call, you're probably a lot further on than you actually maybe realise, because you're here and you're at the information gathering stage. So usually there's a stages of change model that we use in psychology, which suggests that at stage 1, we're pre-contemplative. So we're thinking, we're not yet ready to change, or we're not yet thinking about change. It's out of our conscious awareness, and we're just not willing to consider those options of having another baby. But then stage 2 is the contemplation stage. So seeing a possibility of change. I might be feeling quite ambivalent or quite uncertain about it, but thinking that there could be some change. And I would say most people on this call will be at that stage now. They might even be at stage 3, which is thinking about what to do, weighing up options, and being committed to change. So thinking, yeah, we will try for another baby, but we just need more information and more guidance. So hold on to that you're here, you're present today, you're listening, you're taking in all the information. You're probably much, much further on than you might realise. So yeah, that's impressive that you're here, when your body could be like, oh, I can't think about that, avoid. You haven't. You've put yourself kind of out of your comfort zone and come along today. So well done. Yeah, I think we can't sort of stress enough, and Jill's mentioned it, so just to echo what Jill was saying, but gathering information is so crucial. There are health professionals you can talk to, there are statistics you can look at, there are professionals that you can meet with to ask questions, have guidance. You can make an informed decision, and you can have some control over that decision. And I think that's the thing to hold on to. You're ready to sort of take those steps for change. Gather all the information that you can. You're not wasting anybody's time. Write things down from conversations. Speak to the clinical nurse specialists about what they say, what their guidance is. Remember, there's national guidance to protect you during your pregnancy. So yeah, it's weighing up the options, isn't it? But by putting yourself out there and gathering that information, you're definitely on the step to change. I think for many people, this helps to provide some clarity. As I said earlier, going through what you've been through is completely bewildering, and sometimes that can really cloud our judgment. But yeah, by having a sense of control, gathering information can give you some clarity on your decision making. So I'm just mindful of time, so I'll try and bring my talk to a bit of a close. But I just was trying to think before we spoke today about some key guidance and things I guess I've learned from families who are considering having another baby that come through us as a service in the psychology service. But hold on to the decision to have another baby is rooted in past emotional experiences and memories. And these will be such a strong influence on your decision making. But remember, their memories, those are trauma memories, and they're stored in the brain, but there's no imminent danger. There's nothing happening here and now. So as much as it's hard to think about what you've been through, to remember, to have those flashbacks, bring yourself back to the here and now. Know you can take steps to help your decision making. The other thing is to think about and remember that having a baby is really, really personal to you as individuals and together as a couple. I can't sort of stress the importance of talking about that. Keep talking together. Share what you feel, what you like, what your hopes are, what your fears are. It's okay to name it and say it aloud. Sometimes that really helps to unlock those trauma memories. But just be kind to one another and try and understand each other's perspectives, because you might not be aligned when it comes to your readiness to have another baby, and that's okay. But yeah, keep talking about that together. Also hold in mind you're under no obligation to meet others' expectations. I feel for some families, because I think sometimes there's inadvertent pressure that can come from all angles. Sometimes it's colleagues or friends or other people having babies around you. It might even be family members that think that that might be the way to support you, have another baby and to help you move forward. But again, this is yours decision to make. This is entirely personal, so you don't have to feel you're fulfilling other people's wants and desires. Sometimes I hear in therapeutic sessions about siblings who understandably have gone through maybe a previous sibling being born and difficult experiences of cardiac surgery or hospitalisation. And sometimes they're a really big influence on decision making. I would absolutely agree. We must always consider, our other children in decision making. But it's natural for their wishes and feelings to be ones of anxiety, or their memories to be ones of anxiety, and have open conversations if they're of an age where they can have a conversation with you. Speak to them about it. What you're nervous about. What do you remember from when your baby brother or sister was born, or when mummy and daddy were pregnant with your baby brother and sister? Try and talk to them a little bit more, rather than it just being as black and white as, well, our other child has said they don't want another one, so we're not going to. If you would like to, and you would like to have another baby, hold that in mind and know that you can support your other child with whatever they've been through. There is also counselling and support available for children whose siblings have gone through cardiac surgery diagnosis or has sadly died. Always seek support from healthcare professionals. Again, I can't stress enough the wonderful work of the clinical nurse specialists. Again, they're at the end of a phone to talk to. You know them, you're already involved with them or will have been involved with them. Do talk to them about anything that you're concerned about. And it's okay to ask again and again. When you're processing on decision making, sometimes you might need to sort of hear it from different people or different professionals to help you gather a really clear picture of what to do. But you can speak to all types of healthcare professionals. There's genetic counsellors, there's cardiac surgeons, there's your medical teams, cardiologists. They have a wealth of experience and expertise in future pregnancies. So yeah, do speak to them and use their expert opinions. They will be able to help guide you in your decision making. And what they help do, which is something we can't always do, is help separate the facts from the emotions. Sometimes it's the facts that you need to be thinking about when you're making those decisions, not to dismiss the emotions and the memories that you've been through, but know that they can sometimes really cloud your decision making and judgment. So try and hold on to the factual information and let that guide you. You can also ask for psychological support. So there are psychological services up and down the UK offering care within congenital cardiac centres. You can also ask your GP for counselling or psychological support. And for many services across the UK, you can go to, it's called IAPT, which is Increasing Access to Psychological Therapies. So if you type your location and IAPT in, you can self-refer for up to 6 sessions of counselling to help you. And it might just be to unlock some of those trauma memories that you have and help you with that decision making. And finally, my last message is just to be really patient with yourself. The decision to have another baby feels hard because it is hard. Take your time, gather the information, stick to the factual information, consider the emotions, of course, but know that there is always support out there to help you emotionally. But keep talking to trusted family, friends, colleagues, professionals, health professionals. And yeah, take your time to weigh up the risks and the benefits at a pace that feels manageable for you. But yeah, it's really, really impressive that you're listening in today. I'm sure many of you jotting down notes, taking information in, and maybe we'll watch this webinar back, but you're already on the right step to decision making. So yeah, thanks ever so much for listening.
Thank you so much, Rachel. That was absolutely fascinating and very reassuring as well. Whilst you were talking, I was able to just have a quick look through the chat as well and just see quite the range of experiences and people we've got joining from all around the country, actually, from as far afield as Stornoway down to Staffordshire, the Isle of Man, Huddersfield, Edinburgh, all over the place. So thank you, everyone who has joined. And thank you for sharing your stories. And it's clear that everyone is coming with a unique perspective, as you said, Rachel. There's been people who've been brave enough to say that they're bereaved parents and they're thinking about it from that perspective. Other people whose little ones seem to be doing okay. So there's all sorts of different experiences to play into that mix, isn't there? just whilst we're chatting, if anybody has got questions, we've got a couple of questions that we'll go through in a minute. So Gill, if you're able to come back in as well, we'll work our way through the questions. But whilst we're chatting, if you have got a question, please do feel free to pop it in there. And please do also look through the chat, because Vicky's linked to various resources within Tiny Tickers, which you might find very useful. One of the things that was really interesting to me there, Rachel, was when you were talking about trauma memories, and I guess just thinking about it from my own perspective, there were 2 or 3 points on the journey when we had our boys, after our daughter who'd had CHD, that hit home. And the first one for us was going back to the 20-week scan, because that's where my daughter's diagnosis was first detected, where her heart condition was first detected. And that 20-week scan, which for so many couples can be such a sort of a joyous experience, suddenly became a real stress for us. And it really, I remember it really knocked me off my feet. I wasn't expecting that to be such a powerful moment. I thought it would be more when we got into hospital. So sometimes these things do sort of just hit you, don't they? And you have to sort of think about the stages you're going through on your journey, I guess, and where those difficulties might appear for you. Sorry, you're on mute, Rachel.
Sorry, apologies. No, I was just nodding and humming along. Yeah, no, sometimes you think you might have handled something or processed something, and then, like you say, the smell of the hospital or the smell of the gel on your tummy, anything like that can just trigger those memories. And sometimes really important just to ground yourself, take a breath and ground yourself into the here and now. But you're right, the triggers can be everywhere, can't they, John?
Yeah, and the one thing that was another point that I personally struggled with a little bit was when our oldest boy, Max, when we took him home, because my daughter had been in hospital for 12 weeks. And then all of a sudden we had a healthy newborn and we were home within a few hours. And that was such a discombobulating experience. It was a very strange experience. I was like, shouldn't there be loads of nurses looking after us and things like that? So it does hit you at different stages and not necessarily when you were expecting as well. So I think, as you said, the fact that everyone who's joining or viewing this webinar is already thinking about those things, it's got to be a really positive thing, hasn't it?
Absolutely, yeah.
Brilliant. Okay, well, we have got a couple of questions, so I'll just go through those. The first one is I think it's a really interesting question, actually. It says, for parents who had an antenatal diagnosis where all screenings didn't catch the CHD, and then there was a sudden decline at home, even if they've had the best case scenario of a perfectly healthy child subsequently. It says, how do we handle mentally the mistrust and uncertainty that you have, especially in the intensity of postpartum period? So I guess if you've had an experience that you weren't happy with, and then suddenly you're going to the same or similar healthcare providers, I guess that's a really difficult hurdle as well, isn't it? That trust.
Yeah, I was just thinking of the importance of naming it really early on. So if you are going back to that medical provider, to name from the get-go that it's okay to say we did lose trust in professionals or the sonographer or the experience we had, to name it up front when you're meeting with those professionals. Some families, you're not obliged to go through the hospital that you might have had your previous baby. You can have choices in where you want to deliver and go through your maternity care as well. So I think when meeting with the midwife at that first check, which I need to let me know, Jill, is it sort of 6 to 12, pre 12 weeks, isn't it? 6 to 12 weeks. It's worth naming it with them and saying, I'm frightened, I feel I've lost the trust, and yeah, where can I go to have my maternity care, my fetal care, and to potentially change hospitals. It's really hard, isn't it, to think about, like you said as well, John, going back to the same hospital.
So if the new ones come in on that one, Jill.
I was going to say, I think that, I mean, obviously I'm a fetal nurse specialist, so I see families in another pregnancy, and it isn't always, we're going to come for our scan, and we have that great reassurance that despite having that echo and seeing somebody and somebody saying that echo does look okay, it doesn't take away the trauma and the mistrust and the fright. People are frightened, but I think that you're right, Rachel. I think that families are able to say, I'd like to go here, I don't want to go back there. And we do have that experience. We have families where sadly, a baby has died and they don't want to come back to the same centre. They don't want to see the same people. They don't want to come to the same environment. They don't want any of that experience. They would rather go somewhere else. And everybody who works with families in this situation would just say, where would you like to go? where would you like to go? We'll send you where you want to go. We completely understand that you don't want to come back to see us. And we've recently had an incident where we had a mum in another pregnancy where the previous pregnancy, it wasn't an antenatal diagnosis, but it was a very serious heart condition. And the cardiologist, we realised who she was because I looked at the list and thought, oh, I know her, I know that mum. And we realised who she was, and the cardiologist went in and said, I'm really sorry about what happened last time, and I know you didn't get an antenatal diagnosis, but obviously what we're going to do now is we're going to do A, B and C, and this is how we're going to look after you. But if you don't want to see us and you'd rather go somewhere else, we can arrange that for you as well. So I think it's right. I think speak up and say to people, I'm really scared, and I'm really scared that what you're going to tell me, I'm not going to believe you because of what's happened with a previous baby, and that's okay. You know, that we're here to help you in any situation, really.
Really interesting. So to basically voice those concerns, talk to
Yeah.
Yeah, thank you very much. And then the other question we've got is asking whether there's any mental health services for children that have CHD and are then going to become a brother or sister, because there's some support for siblings, isn't there, whose little brother or sister has just been diagnosed, but they're asking, is there anything the other way round for children who've got CHD?
Yeah, and obviously all services differ in their kind of remit into what they offer, but I would certainly ask at the centre that you're under, the hospital that you're under. Sometimes there's it might not be that they can get formal counselling or psychological support, but sometimes there's groups or sessions. Sometimes clinical nurse specialists actually put on workshops and things like that. So certainly go back to the cardiac centre, which your little one was under or is under, and ask the advice of the clinical nurse specialists and see if you can have a referral through to psychology. If not, see what's on offer. I know in West Yorkshire there's groups and days for siblings to come together and meet other siblings. Yeah, it varies kind of region on region, but there is a lot out there, and it's because it's in national guidance. The government have recognised the impact and the ripple effect on everybody in the family, experiencing cardiac diagnosis. So there certainly is support out there, and it might also be worth speaking to school. I know schools have access to counselling sessions and services that come into school and offer emotional support. So yeah, there's certainly certain routes you can explore that mental health input.
I guess that's a similar message, isn't it? That you might not have been in touch with the cardiac nursing team, depending on your circumstances, for a little while. So it is kind of re-engaging with them and just talking through, okay, what can we access, what is out there. Fab. And then I think that's the two questions. There's an interesting comment in the chat as well, which I'll just dive into, about how everything seems overwhelming because in the particular commenter's case, they said they sort of got lucky with their daughter's CHD, that it wasn't as severe as they see on the Tiny Tickers Facebook groups and different things like that. They know how severe some cases could be. So in a sense, they felt as though they got lucky because their particular case wasn't as severe. But then that in itself is quite an overwhelming thought of what if it goes wrong next time? What if it's worse next time? And I know it was interesting from a parent perspective. I often think this, that because of what I do, I've sort of surrounded myself with this world of CHD, and I almost forget that there are babies out there who don't have heart problems that are perfectly fine, and you do get sort of stuck in this world a little bit, don't you? And mentally, that can be quite difficult.
You were sharing, Jill, weren't you, about the rarity of some of the statistics and information that we know, in that little video that you showed. But you're absolutely right. When you've lived and breathed and gone through that experience and experienced the trauma of that experience, it's hard to see. It's like tunnel vision, isn't it? That's bound to happen then, and our brain can sometimes fill in the gaps. Well, that was my experience of pregnancy, so it'll be like that next time, and almost like that's your blueprint, but it isn't your blueprint. It doesn't have to be your blueprint for future pregnancies. And you're right, John, hold on to that. Many thousands of babies are born up and down the country, healthy, fine, developing really, really well. And like you said about your son, home within the hours, and yeah, no medical input needed. So it's hard to hold on to that. Your brain will always take you back to your memories of that experience. But yeah, you're spot on.
It was interesting what you were saying in your talk about that, actually, that you get that flight or fight response, even though it's a memory. It's not something you're experiencing now. And guess it's an extension of that, isn't it? That because you went through that experience, or because other people have been going through that experience, it might trigger those feelings in you, but it's not a reality that you're dealing with at this point. Yeah. Really interesting. Okay, well, thank you very much, everyone. I think we've answered all the questions. Obviously, Tiny Tickers, we're here if you've got other questions. I would definitely say, if you're not already, go onto our Facebook group of families, because there's all sorts of experiences there, and there will always be someone who's sort of further down the journey than you are, that you'll be able to talk to, and you could really pop questions into there, and you'll get some really good conversations. One of the things we did in preparation for this webinar actually was ask some questions within that group for people to share their experiences, and we're collating all of those, and we're going to send those out as part of the handout, as part of the information you'll get subsequently to this webinar. So you will get loads of quotes, loads of experiences from other parents who've gone through this process and considered all the same sorts of things. If you'd like to join any of our support groups, then please feel free. You'll see the likes of Rachel and other amazing facilitators we've got, and those are great safe spaces to talk to other heart families about these sorts of issues as well. So please do consider signing up for those. Yeah, we'll look out for the email. We'll send an email with various links and bits and bobs on it, signposting and different bits and pieces. So that'd be really good. Do follow us on social media if you're not already. But thank you so much for joining us, wherever you're at in your journey, whatever decisions you're making in the future. I hope everything goes really well for you. And I think one of the things that's come shining across today is that we're all in a unique place, aren't we? There's no right or wrong answers to any of this. Everything you're feeling is completely valid. Everything you're considering is completely valid. But talk to people about it, seek some support and seek some help. So thank you so much to Gill and Rachel for sharing your time and expertise as always. It's very much appreciated. And thank you everyone for bearing with us with the technical difficulties we had. We'll make sure we get that video link sent out to you. I really appreciate your time and patience with us. So I hope you've taken something really positive from today, and have a great rest of your day. And hopefully we'll see you next time at another future Tiny Tickers webinar. Thanks for joining us today.